Hello, my name is Carissa Doherty, and I'm here today with my sister Sonia Doherty and my colleague, Dr. Nora Pope, who's a naturopathic doctor. Nora and I went to school together forever ago. So we're talking today, we're kind of promoting our platform, Exceptional ND. And I've known Nora for a long time and I find her very exceptional. She actually has a course right now, she has a fertility course, continuing education, which is fabulous. I will let her talk a little bit about kind of that course and go from there.
Well, very happy to be here, ladies. Thank you for inviting me on. So just to a quick pitch about my course, it's called Fertility CE, short for continuing education. It's produced by me and Dr. Jessica Liu. And I remember in school, in first year at the Canadian College of Naturopathic Medicine, where we met, we were talking about cycle charting. And I think I asked the class, who knows if they're fertile or not fertile today? In terms of natural family planning, who knows for sure? And I put my hand up, and I think I was the only person in the class who did. People had thought about it, talked about it, but I knew 100% that I knew if I was fertile or not fertile, because I had been taught the Creighton model fertility care system and for health reasons. And I wanted to know my hormonal levels. And, I had very mild PMS. I mean, I was quite lucky, but still I had, mild PMS. I was a little bit anxious and blue before my period. And entering naturopathic medicine school, I wanted to be smooth sailing for my health. And so it was great. I learned about progesterone and what my levels should be. It was a wonderful, wonderful tool. And then now with over 20 years, since graduating, you address all kinds of concerns in practice, whether it be acne or PMS or epilepsy or infertility. And it's really nice to be able to share this knowledge with doctors and naturopathic doctors all over the world, because, typically women are told to test their progesterone on day 21 of their cycle. And that's assuming everyone ovulates on day 14. And that's incorrect. With only 13% of women ovulate on day 14. So by learning about when you ovulate with studying white flow and estrogen rising, then you can really accurately time your hormones, time your ultrasounds, time your dosing, and have the most accurate dosing. And then the chart reveals the positive changes as we restore health. And it becomes a roadmap for treatment. And it becomes a nice prognosis tool saying, okay, as a good prognosis, if you have 3 or 4 consecutive healthy cycles, your body is restoring itself. So it's a wonderful, wonderful tool. So fertilityce.com is the website. Happy to share it. And I love it. I'm very, very happy. And we'll be doing more content next year at some point. So thank you for the pitch. I appreciate it.
So I didn't know about it at all. So when you mentioned it in first year, it was like I went down a rabbit hole, and I thought it should be taught in high school. I mean, the charting should have been taught for young women and young men, just sort of to know that actual information about their hormones.
Well, I'm so glad you mentioned young men, because I went to the Toronto French School and they asked me to do, a career day. So I talked about naturopathic medicine, and then I had 2 biology classes. I said, okay, I'll talk about human reproduction. Easy. I'd love to talk about human reproduction. So the first class was, 12, it just had to be 12 girls. So I said, okay, well, when you have your cycle and when your estrogen is growing, the follicle's growing and releases estrogen in the blood, and that turns on estrogen receptors in the cervix, and your body releases cervical fluid or cervical mucus. I prefer fluid. I find it's more media friendly. And that changes your body from being acidic inside to being alkaline, and it can keep sperm alive for 5 to 10 days. So your fertility window can be quite long. It could be up to, let's say, typically 9 days in each cycle, even though your egg is only alive for 24 hours. So, and they're nodding and they're really interested. And a lot of girls were put on the pill because they had acne. And so they were really interested in learning about ways of getting off the pill and treating their acne and restoring their health. Then the second class, I had 1 girl and 11 boys. I go, okay, how am I going to make this palatable? So I come to the slide about, anatomy and physiology. And then when I talk about male anatomy, and I said, white flow, you produce white flow, boys. When to make a baby, you need to produce white flow. So boys produce white flow and girls produce white flow. And that was how I got that term, just under the stress of trying to make it palatable and inclusive. So the tagline that we have at our company is called White Flow Makes Babies. And that's our trademark. White Flow Makes Babies. So we'll have it on a t-shirt one day. And that's to really encourage the idea that it's not women who make babies, it's men and women together who make babies. So when Stats Canada says in 2011, more women gave birth than any other year before, I wish they would say in 2011, more men and women had children than any year before, because you need white flow from a man, from a woman, and a healthy egg and a healthy sperm swimming in the white flow. And we're conceived in sugar and water, which is what white flow is, in the fallopian tube. It's very beautiful. And then the conceptus tumbles through the tube and plants in the uterus, all bathed in white flow. And that's what we're trying to teach. And so the boys got really interested. They go, wow, that's so cool. And I thought, I did it. High school. So absolutely, every high school kid should know this. I agree with you. So, yeah.
That's amazing. I have two boys, and I think it's such an amazing, beautiful thing. It's incredible to hear it from your perspective, because I think from a medical standpoint, right, there's a lot of pressure on women when it comes to pregnancy. And I know I took Chris's maternity leave very briefly years and years ago, and it was a big eye opener how much pressure it was for women in particular. So
yeah, it takes two.
I think one of the most incredible things about you, Nora, is that you've been so great with supporting people with seizures. I do, as lots of people know, have a practice that's focused almost entirely on autism, and lots of those individuals do have seizure disorders. And it's, my mentor, Dr. Julie Buckley, has said, as hard as autism is, seizures are even worse. And so to help those patients, I've always found that incredibly inspiring for you to have, tackled such a tough condition. So, I mean, I'd love to hear more about that.
Yeah, I think what was helpful for me is just be honest. When you're honest with the public and with patients, and when you keep telling the truth, you gain their trust and respect. And I gained a lot of trust by saying my last 100 patients, I think 11 have no more seizures. So 11%. And it's not 90%, it's not 50%, 11%. So I would just give them numbers. So 11 had no more seizures for the last 4 months. So just be very precise. And because I would do follow-ups every 3 or 4 months. So, and then I would say another, 23%, so we're up to 44% now, had less frequent seizures, or if they did have seizures, they were less intense, less debilitating, less fatigue, less anxiety before and after, and they could recover more quickly. And it was less dramatic, because the worst thing for someone having a seizure is that people freak out, call 911. It's not really necessary. And then they don't want the attention on the seizure. They just want to feel like a human being, and they're not a seizure, they're a human being. So for about 44%, I could really help them with the anxiety. And then the rest, the other 56%, I help them with their sleep. I help them with their energy. I help them with their quality of life. What else was big with seizure? Oh yeah, anemia. So these are just, I was trying to restore their health as best as I could. And then I got interested in progesterone, because with some of my female patients, there was a consistency that maybe the 8 days before their period, it would bring on a seizure quite regularly, month to month. And so low progesterone can be a trigger for seizures in some women. So it was just very naturopathic. You looked at the whole person, you treated that person in a multidisciplinary way, an interdisciplinary way. There's so many layers to it. And it was interesting. And I think a big goal I had when I was in practice, which I closed, by the way, in 2019, but I'm very attached to this community, is, I wanted to give my patients what I call naturopathic literacy. That I said, I need at least 4 visits. I'm not going to tell you to come 3 times a week, but I'm going to tell you to come once a month maybe once every 3 to 6 weeks, but come 3 or 4 times. So you know what makes you feel good. You know what makes you feel bad in terms of your lifestyle, your sleep patterns, having an electronic clock in the room. We've those before smartphones when we started. How much water you should drink. Don't drink a lot right before bedtime. It's going to wake you up, and then you'll have to pee, and then you have interrupted sleep. If you track your cycle, when do you feel good in your cycle? When do you feel less good in your cycle? So this takes time in terms of getting people to do mental diaries or diet diaries or physical diaries or journals, and they can correlate. Oh yeah, if I had a bigger breakfast, or if I had, let's say, tuna salad or chicken salad for breakfast, I felt better because toast and cereal were empty calories, and I just didn't. I'd feel hyper afterwards. I didn't feel good. So it just takes time. And then also by removing these mini obstacles to cure, then you can see the true picture. So that would help with classical homeopathy. And then with the TCM, I kept doing tongue and pulse at each visit, no matter what, even if I didn't do acupuncture. And it was another way of monitoring. So, and after about 4 or 5 visits, you could see people gaining that independence, and then blink, the twinkle in their eye would light up. And that was very rewarding. So when I talked about my epilepsy patients, 56% having not too much change in their seizures, but they felt better in other areas. That's what I'm alluding to. They gained naturopathic literacy. Yeah.
Yeah, I love that. And I think one of the things we're hoping for out of Exceptional ND is sort of giving this really important knowledge to other practitioners. I think in particular, younger practitioners who don't have, all those clinical pearls all the time that they're thinking about. But it's about the honesty piece. It's about having like a system that you can share with your patients and empower them. And I also feel like, I want people to feel confident tackling things that are big conditions, right?
Yeah.
We can help a lot of people who have some of these more scary conditions, fertility, obviously seizures, and we can really help these patients and these families if we just build that confidence. So that's amazing.
I agree. I mean, I really love being in clinic at the Canadian College of Naturopathic Medicine. I remember my very first patient, Chris, I think we treated her together.
I know we did.
Oh my God. Oh my God.
God.
Yeah, like she had everything. She had rheumatoid arthritis. She had congestive heart failure. She had anemia of chronic disease. I mean, you name it. And they were very loyal. And, and I thought, oh my God. So the point is, I was naive when I started naturopathic medical school. I thought, oh yeah, I'm going to have these lovely granola patients and we're just going to be all kumbaya. And then you get into clinic and 92% of my patients were on prescription medication. So you had to know drug-herb interactions cold. And of course, there's very little information out there. And there's a lot of putative, documentation. So you had to put 2 and 2 together. Okay, what's the cytochrome enzyme involved for this herb and this drug? And, we don't want an antagonistic interaction, and how do we have an optimal interaction where we can enhance the efficacy of the drug? And maybe they'll need a lower dosage of the drug if need be. So I found drug-herb interactions with trial by fire. Just you jumped in. And I'm proud to say that in my entire career, I only triggered one reaction, in a patient. I gave them milk thistle, and it triggered a symptom. And then I read up on it, and I could explain why to the patient on the next visit. I said, I'm very sorry, this is what happened. And this is why it triggered this reaction in you, because I looked at the cytochromes, I looked at the additive effect that the herb could have had on this particular person, based on the physiology of their condition. So I gave a lecture on drug-herb interactions at Northwark General Hospital. And get this here, I'm going to back up a bit. I'm going to show you how the surgeons were looking at me. So here. So this is I had a lot of experience with knee replacements and hip replacements. And there's a protocol in Canada I really respect. It's a lifesaver. Anyone going through knee replacement or hip replacement is put on blood thinners after surgery, because as we were taught in naturopathic medical school, when you cut into a bone marrow can leak and circulate and cause either a pulmonary embolism or, God forbid, a stroke. And so by going on a blood thinner right after surgery, you eliminate unnecessary death. And so I really respect this protocol. So I learned about warfarin up and down, in and out, all around, everything but warfarin and heparin, which were typically given at the time. Now they have other options. And I was able to help patients recover faster, even on blood thinners, which is a very scary drug for a lot of people. But no problem. This is what you do. You time it. You look at the half-life of the drug. You time it accordingly. And then these blood thinning foods, supplements, substances like vitamin E or that beautiful blood building here, what's it called? I'm losing.
Nettle?
Sorry? Dong Quai. No, Dong Quai.
Okay.
Dong Quai has a mild blood thinning, but it's a different mechanism. So it's going to have an additive effect. It will not interfere with the drug. So the drug can do its work. You wait for the half-life, and that's when you give the herb or the supplement. So there's no interaction, and then there's a mild additive reaction, which keeps the blood moving gently, but and safely. And so for me, that was, a very satisfying lecture. I called it Before and After the Knife, the do's and don'ts of mixing blood thinners and naturopathic medicine. So I explained about the timing and the interactions. Anyway, so I got a lot of patients from that lecture. The plastic surgeons put their hand up saying, "Oh, my patients love naturopathic medicine, especially arnica." And oncologists referred to me because they could see that in terms of side effects or unpleasant, the unpleasant regime of going through chemotherapy, I could alleviate some of the suffering and also increase the efficacy and also help restore the person's health and energy. So the audiences will respect you if, again, you're honest and you just say, okay, the challenge is before us. How do we mix all these therapies? And naturopathic doctors are in a wonderful position to do this because they've studied it and they've seen it in clinical practice, what works and what doesn't work. And so, yeah, I say just go for it. That was my toughest audience. No one scowled at me before. Oh, there was another audience in Toronto. I was at this women's group. Oh my God. I think there were 12 women, cackling away in the back. And I thought, okay, I'm a feminist. I will soldier on. But the point is public speaking builds character and also you stay current. And I think that's another reason why I recommend that people write at least one article a year. You don't have to do a lot, but if you write one article a year, you keep your skills current, your reading, and you'll get patients that way too. So I think I enjoyed it because I like the teaching part of being a doctor, docere, teach the patient. I really like it. I like giving them that information. They get the twinkle in their eye. They go, aha. For me, it's fun. It's the words as well as the treatment protocols, I think, are both Puritan. So absolutely, I just say jump in. We wrote an article about it actually in the Ontario Association of Naturopathic Doctors about jumping in and just go for it, So me and Jessica wrote an article. So.
I like it. We'll find it. We'll attach it to the
bottom
of this video.
We'll find it.
Yeah.
That's amazing.
Yeah.
Thank you. Yeah, it just came out, and it's I'll send you the PDF because it's not easier to read than the more high-tech version. So
that's great.
Amazing. Thank
you, Nora. This was amazing.
Yeah.
Every time I talk to you, it's been a while. I know I have to go into Toronto and have some wine with you, but you're always a wealth of information, and I never really know what you're gonna say. So I never know where it's gonna go, but I always learn. I always learn when I talk to you. So I appreciate you coming on.
Doctor's teacher. There we go.
I know.
Yeah.
Oh yeah, and I think I like to finish off with something. People ask me, Nora, you have no children. You've never been pregnant. How come you're interested in fertility? And I'll tell you why. I'm very interested. I'm very interested in a term called body literacy. Body literacy was a term coined by Planned Parenthood of all organizations. The woman was called Laura Werschler, and she taught cycle charting back in the day when Planned Parenthood was bohemian and into public outreach. They've changed now. They're completely different. But body literacy, I find really interesting. It's like, it's so naturopathic. Because when I was growing up, I'm a little girl, right? And my parents were very social. And I go to a lot of Christmas parties and they said, "Oh, your poor mother, 7 children. your poor mother. And after a while, if I had been older, I would have said, when are you trying to say, lady? I never should have been born. Like what's your point, you know? And I never want to hear a child ever hear that again. Oh, your poor mother. I want that child to say, well, my parents practice, body literacy and fertility literacy and natural family planning, and they wanted me. They really, really wanted me. And I didn't know how to say that at 10, but I know how to say it now. But I would love to give that 1-2 punch to any little girl out there. I think that's a big reason why I got interested in fertility literacy, because especially when you get the man involved, they're very interested in how women's bodies work, and they're very interested in the shared experience of human reproduction. It's very holistic and very spiritual. And I love teaching couples in my practice. And I had a very eclectic practice. I had single women who wanted to get off the pill. I had women with seizures. I had women with acne. And then I had couples who were trying to avoid the next pregnancy or create another pregnancy. And it was really lovely. And I know for certain that those kids are never going to hear, oh, your poor mother, I think it was a very subconscious reason why I wanted to get into this kind of work. And I'm, here I am. So there we go.
We're glad.
Yeah.
We're glad you took it up. Took
Yeah.
up the mantle.
Naturopaths are lucky to have you, and we're excited that you're sharing your information. So if you have any fertility questions, make sure to check out Nora's course. And yeah, I just think it's so important that we get all other naturopaths knowing about the information we know and, collaborating, mentoring. So I love it.
Right. Thank you very much. And again, Exceptional ND is our platform, and we'll have information below. Take care. Have a good day.
Thank you, ladies.
Take care.
Bye.